28,462. That's the number of children that were abused in Indiana last year.
The frightening thing is, this number is only rising. In 2013, 13 out of every 1,000 children in Indiana were victims of child abuse. In 2017, only 4 years later, that rate rose more than 50% to be 19 of every 1,000 children.
Of all 50 states in the nation, Indiana has the second highest child abuse rate. Based on these few facts alone, Indiana's child abuse problem is clear to see, but what isn't so clear is the huge effect that abuse has on the children.
The lack of positive reinforcement that parents display to these children lead them to develop a sense of unwantedness, later causing a plethora of mental problems and disorders. Just a few include eating disorders, passive-aggressive behavior, sleeping and speech disorders, and developmental lags in motor skills.
Because the abuse happens when the brain is still developing, children who are victims of child abuse actually have different adult brains than their counterparts. This means that the effects of the abuse far outlast the abuse itself. Those who are abused are vulnerable to a lifetime of mental health issues. As a result of their being victim to child abuse, many children fall into foster care.
Because Indiana's abuse rate is so high, foster care in Indiana has become overwhelmingly populated. According to data from the Adoption and Foster Care Analysis and Reporting System, Indiana's foster care intake has more than doubled since 2001. This represents the sharpest increase in the nation.
Along with taking in more kids, Indiana's foster care keeps children in the system longer than other states. The average time that Hoosier children spend in foster care exceeds that of the nationwide average by 4 months.
At this point, you may be questioning why this is a problem. What's wrong with taking children out of abusive situations and placing them in foster care? While foster care can provide some good things, overall, foster care has been proven to be emotionally damaging to children.
Of the 400,000 plus children in foster care in America, it's estimated that nearly 80% suffer from significant mental health issues. That's nearly 4 to 5 times the number that's found within the general population. Children placed in foster care at young ages compared with their counterparts are disproportionately struggle in school, have trouble finding employment, and abuse drugs and alcohol in adolescence and early adulthood.
In order to reduce child abuse, we propose having a statewide checkup on every household with children to ensure that they are in a stable environment and receiving the proper care.
In the new policy for the foster care system in Indiana, requirements for all Hoosier foster parents will become more strict in order to ensure that living conditions are suitable for the children. The children will also be able to better connect with these more qualified foster parents.
The goal of this new policy is to reduce the amount of abuse that is seen in Indiana homes, help create healthy family relationships, and provide children with safe and stable environments. Therefore, this policy will help to prevent the mental health problems that arise due to unstable environments and ensure that foster care children and child abuse victims receive the proper mental health treatment to build a brighter future for themselves.